Okay, so my first question is an easy one. And because I know you as Happy Tooth, obviously from social media. And then when I learned your name, I was like, oh my God, is he related to Tom Hanks?
Great question. I wish I was asked that more often. I tell a lot of people he's my uncle, but I'm sure we're related, some distant line, but no.
I've never heard that last name before, other than him. Have you?
I mean, other than myself
No?
and him, no,
Yeah.
like, I
It's
don't
not a
know.
common
I just know
name.
my cousins. Yeah. It's a good name. I use it, in jokes from time to time with the little kids I see all day. Dr. Hanks, like, thanks. Yeah.
I love
Just
it.
full of dad jokes here. Yep.
Okay. The first thing I wanted to talk about was dental phobia and white coat syndrome. So, white coat syndrome, we're often connecting that to physicians, like going to see a doctor, but the dentist is the exact same thing. They're usually in a lab coat, they have the lights on their heads. It can be, a little bit scary. So, why do you think dental phobia is so common, even in adults? And how do you guys practice dentistry differently to kind of prevent that from happening in kids?
I can give just my opinion on all these things, as well as some research based evidence. As far as dental phobia goes, my experience as a kid, I was terrified. I think a lot more terrified of the dentist than my normal doctor. The normal doctor, you're
Mm,
sitting on the table. Yeah, you might not have your shirt on or something like that, but it's not. You're sitting up for the most part. Sometimes you lay back, and I feel like that laying back, being so vulnerable, just laying down. All you can see is the ceiling. You're not really aware of everything that's going on around you. But the dentist is coming right towards your face. They're coming, with sometimes this really big needle, or something spooky like that, or these really loud sounds. Even the suction, I remember as a kid being like this, such a new sensation, right? Going to the pediatrician, and I don't mean to compare a pediatrician to pediatric dentist, but yeah, I just feel like that sensation that I remember as a kid, all those new, just out of this world sounds and feelings as a kid, they stay with you. And the evidence is there. Half of insured America didn't see a dentist last year.
oh,
So 50% of people paying for dental insurance didn't go to the dentist last year. And I largely believe it's because of dental phobia. We don't love having people poke around in our mouth. We don't love laying down. We don't love, I think in some cases, being told that we're not brushing our teeth the right way or enough.
yeah.
But also, we carry with us some of those terrifying experiences as a kid and there's a lot of things we do to combat that, and we can go through that. But I just, yeah, I remember as a kid, I don't know how much prep work my parents did, but just being so terrified of all the things that is a routine dental visit, and then definitely dental treatment.
Mm. The sounds, like I'm 38 years old. I just went to the dentist yesterday for a cleaning. I'm like a very good patient. Um, but it's the sounds. Like I wasn't even getting a treatment thing done. And she was like, okay, I'm going to use this like water pick descaler thing. And I'm like, okay. Um, and I'm like, oh, like the sound. It's like, "Ee," and it's almost like the sounds makes my anxiety increase because I'm like waiting for something to hurt me, even though
Yeah,
it's not going to hurt me. Yeah.
1000%. And so all those things, not just the sound, because it might be sounds going into your mouth, but sometimes in a lot of dental offices, you're hearing the other drill or the other sounds going on in the room next to you, because most dental offices have this kind of open bay format. So it's not just sounds happening to you; it's the sounds around the office. I think it's the smell too. I think anyone would be like, "Oh, it smells like a dental office." They all just kind of smell a certain way, and definitely the aesthetic, and that is across the board, just in healthcare. Like the environment is very boring.
Sterile.
Yeah, yeah, and I got away from using that word because I said, I don't want dentistry to be sterile. I don't want to be boring. People are like, hold, you got to have it be clean. Yeah. I want it clean, guys. But it is sterile. Like dentistry, healthcare in general, the environment is often very boring. And so something we've done, something I did after years of training and working at different dental offices is I wanted to create a spot that the second you walk in, it doesn't look like, smell like, feel like, sound like a dental office. There are some things like the ultrasonic scaler you're talking about, or, our little drill. I call it a brush, but our drill we use to brush out decay. You can't get rid of some of those things yet. We're not there yet from a technology standpoint, but there's so many other things you can do to mitigate that, like headphones or having, the rooms that we're doing those things in be really private and soundproof. And so, yeah, I mean, there's just so many details that go through about what we do and what I've done specifically to design a spot from start to finish, that mitigate those fears, both for me and parents and kids, because parents will bring their own fears
Yeah.
and give those just right onto their kids without really knowing most of the time. And so I gotta play that game with both parent and child to alleviate fears.
When do you recommend that parents bring their child to the dentist for the first time?
Yeah, so the AAPD, the American Academy of Pediatric Dentistry, recommends first tooth or first birthday,
Oh,
as far
okay.
as establishing a dental home. And I talk to, lots of pediatricians. I talk to lots of doctors and definitely lots of parents. And I think a lot of people are surprised by that. Like they got like two teeth at that age, or they
Yeah.
got four teeth. And it's much less about we're trying to find decay.
Yeah.
It's way more about establishing a home, a dental home, building trust, getting familiar with the spot, and educating parents on healthy habits. I mean, there's some kids at 18 months old, I've had to take out all their baby teeth,
Mm,
which seems crazy, but it's true. Or 2 years old, having to put 20 crowns on a kiddo. So education is crucial at that age, is getting parents in with these young kiddos. But I use it way more commonly in my practice here in Salt Lake City as a time to start to build trust with kiddos.
yeah. So what would a first appointment with a really young kid that maybe has like one tooth, what would that look like?
Very similar to the process of coming into the office and coming into the room. Very similar to any other regular dental appointment. Now, whether the kiddo is 1 or 3 or 5, 6, 7, if they are just terrified the second they step in, we treat them all the same. We meet them where they're at. So if a kiddo, whether again they're 7 or 1, they're just not having dental x-rays or they're not having the cleaning because this is all new, we meet them where they're at. We ask parents, well, how do you guys brush at home? Can you show us? And for a 1-year-old with 2 teeth, similar process. How do you show us how you brush at home? And that's usually all we're getting done, for a 1-year-old, is a little exam, brush their teeth, and in some cases we do varnish, a little fluoride varnish. And oftentimes at that age where sometimes kids can't even walk yet when they're in our office, mom's just holding them.
Yeah.
And we have moms hold kids that are 5 or 6 that are just terrified, and that's okay. That's kind of where we start and I don't know if every dentist does that, but that's my philosophy, is let's meet a kid where they're at. Let's meet parent where they're at, regardless of the kid's age, and let's build trust and go from there. And now, there can be urgent things that we got to work around and find a different plan for, but I found a lot of success in easing into all those crazy sounds and sensations that is a routine dental visit.
I remember we took Milo, he's 5 now, and we took him when he was about 12 months old. And I remember thinking, like, even if he just goes in and sits in the chair, like, even just them sitting in a chair that's like kind of leaning back, and the process of going into the office, waiting in the waiting room, like, For me, it was just the experience. Like if he sits in the chair, like that's a win. But I did a ton of prep before bringing him to the dentist office, like showing him YouTube videos about like kids going to the dentist. On Amazon, you can order like kid versions of dental tools and like they can
Yep.
pretend to do it in your mouth. Or I would always ask him, I still ask him like, "Oh, you have a dentist appointment tomorrow. Like how many teeth do you think you have now?" Because they're going to count your teeth. Like trying to get him excited to go. And like, not to brag, but he's 5 and he has zero issues going to the
Love it.
dentist.
Love
Zero
it.
issues. Is there anything else that you tell parents to do or you would recommend they do before they bring their kid for the first time?
Great question. So, I mean, you hit on a lot of it. You hit on, um, tell, show, do. I'm gonna tell you what it's like. I'm gonna show you what it's like, and then we're gonna do it. And so, parents prepping for that visit is awesome. And I can tell the parents that have had those conversations beforehand, and the ones that haven't. And there's some kids that even with all the prep work in the world, watching Daniel the Tiger, watching YouTube videos, and let me just put a plug in for all the dentists that don't do social media. I have so many kids show up and parents show up. They're like, "That's Dr. Hanks. You've seen him on those videos." And there's like this instant, like, "Oh yeah, I've seen him before, and I've seen him do exams before, and I've seen this space." And so kids like that alone is really one of the reasons I do social media is kids get to see me before they meet me, before that scary moment, and it kind of facilitates that conversation. So just to add to kind of all the things that you mentioned, having a parent maybe go to the website and if the doctor doesn't have social media, go to the website and have the kid be like, hey, that's who you're going to see tomorrow. And because I think there's a lot of anxiety around meeting new people, and so if the kiddo feels like they've met the doctor or the team or the space, there's some less anxiety on that first visit. So yeah, I think I think you nailed it. But I think if I could just plead with a lot of dentists, get out there, get your face on social media. I was so scared of put my face and all the stuff that I do on social media. It's so like my personal social media account. I think I got like 98 followers that I let into my life. Like I don't, but when I started to see the impact it had on kids before they even came to the office, like, okay, we're on to something here. So
Yeah, it's basically like exposure before they go. And like you were saying, a dentist is unique in that it's like, here, you're meeting someone new and now lay back, open your mouth, and we're gonna like look in there.
and they have these sharp tools, but they're not gonna hurt you, I
Yeah, I
promise.
promise.
And
Yeah.
and I know we've held you down and given you shots your whole life, but these guys aren't going to do that. I promise. Same type of laying down, but yeah, I'm with you.
So, what would your message be? Because a lot of my listeners have young children. What would your message be to parents who haven't taken their kids to a dentist? And let's say their kids are 2, 3 years old, and now there's almost like a shame or like a guilt that's blocking them from going to the dentist because they fear like judgment or like, oh, I'm a shitty parent now.
Yeah, yeah. Um, Great question. Like one, find a pediatric dentist, that's not always possible to find a specialist in your area. Sometimes you go to the family dentist or general dentist, and you might feel I guess you can feel judgment or feel like you're being judged any dental visit that you go to. But I feel like pediatric dentists, we're specialists. Like we've seen the worst of the worst. Like I've taken
Yeah.
20 teeth out on a 3-year-old. There's really
Ooh,
nothing that walks through my door that I'm like, wow, this parent is just worthless. Like that's me though. And maybe you're getting that from other parents or sorry, from other providers. But at the end of the day, take your kid in, regardless of their age, regardless of what's going on in their mouth. And if your provider judges you, go somewhere else. It's
yeah.
not the end of the world. You don't have to ever see them again. Because that's really it. Like you want what's best for your kid, and all we can ever operate on is the knowledge we have at the time we made a decision, right? So if we get new knowledge and it's like, oh yeah, I should have taken them in. Okay, then take them in. And if life is happening, that's okay. Like I opened my practice peak COVID, 2020.
Mm,
And so over the last 3 years, I've seen parents like, yeah, we haven't been to a dentist since pre-COVID, and there's some fear there. I instantly try to tell them like, look, I got 4 sons. They see a dentist every night and they all have cavities. So there's nothing that you could like say or do or that I could find in your kid's mouth that is, going to create this judgment or the superiority complex. Like, I'm a dad. I got kids. They eat candy. I brush their teeth. They get cavities. It happens. So just get your kid in. And if you don't like it, go somewhere else.
yeah, it's true. I think a lot of times people feel like they don't have a choice. Like, oh, I'm seeing this person. I have to stay with this person. Like, no, you can switch. Um,
100%.
let's talk about cavities and decay. First of all, I was going through all your TikToks last night and I'm like, is a
I'm
cavity?
sorry. I'm really sorry you had to do that.
No, it was great. I was having fun. Like the basketball court
Cool.
in the office. Like I was like, yeah.
Yeah.
Um, so cavities and decay, are they the same thing?
Generally speaking, yeah. Like I don't really know if there's a specific difference, at least as far as I'm concerned. I use them interchangeably.
Okay. And so the argument that a lot of people make, I think, is like my son has a cavity. We got it treated. When there's noticeable like decay or a small cavity, people assume like, why are we treating it? Because it's their baby teeth and they're going to lose them in a
Yeah.
few years. So what do you say when people have that thought process?
I love that. I'm like, well, then why am I here? Like, these are just baby teeth. You're right. Why do I have a job? Like, what am I doing?
Yeah.
No. So I hear that all the time. And there's a couple different analogies I come back with parents that, depending on our comfort level, we go down different routes. But at the end of the day, your kid needs their baby teeth until some of the baby teeth until they're 12,
Mm,
right? And we start seeing decay again as young as 1 or 2. And so, yeah, I guess it is a baby tooth and it's falling out. But with that logic, I mean, the adult teeth are going to fall out eventually too. With the way you're treating them. Like, so do you want your kid to have active decay that could lead to dental infection, awful pain, um, or be toothless because of that for 10 years or
yeah.
5 years? If they're 5 and they got another 5 years of that tooth, do you want them to be toothless in that spot for half their life? By the time they're 10, they lose a tooth at 5 for half their life. That's like asking a parent, well, that's okay. I mean, it's adult tooth. Yeah, let's take it out at age 30, at age 40 or 50, and you're just not going to have a tooth there for half your life. Like, that's,
Hmm.
for a child, that is crazy to think about. But just as a parent, like, I don't want my kid to experience any more pain than they have to. And that's what we're trying to avoid. We're trying to get kids pain free. We're trying to build trust and fix teeth way before it becomes a painful, infectious experience. There's another. You're going to get my public health background here, but there's another stat that's astounding. Two of them. One is that dental decay, dental disease, is the number one most common chronic disease affecting children in the U.S. 5 times more common than asthma. Um, it's the number one most common chronic disease affecting kids. Number two, dental pain is the number one reason kids miss school. Like
Oh my
53 million
God.
school hours were missed last year from dental pain. So yes, they're baby teeth, but it affects your entire human body. It's the gateway to your health, and your kid's going to need them for a long time. Even if they just need the tooth for another year or two, it's worth fixing.
Yeah.
So
Wow. That stat is wild. I wonder if it's similar in, like, I'm in Canada and I want to look into this now. Like, is it the same? And I was also curious about like accessibility of going to the dentist. Like, is it the same in the US versus Canada? Because there's all this talk about healthcare when it comes to going to the hospital or your family physician, but I was curious about dental stuff. Like,
Access to care. Yeah.
yeah.
I mean, access to care definitely plays a role. But as far as decay goes, it's for a long time we thought it was, socioeconomic status or cultural literacy, or healthcare literacy. How, do you understand what causes decay? It's not that. Even in our most developed or our smartest neighborhoods, we're getting the same level of decay in kids, or the neighborhoods that have access to care. Again, half of insured America, they're paying for dental insurance, didn't see a dentist last year. So this is a big problem. And yeah, I don't think it's unique to the U.S. I think it's pretty global. Um, and yeah, access to care plays a role, but I really think it's the fear. And not just fear, but maybe a priority. Like, I'd rather pay for a cell phone bill than pay for dental cleaning or pay for, to fix my kid's tooth.
Getting decay or cavities, is it something that is like, are some people just more prone to that happening regardless of how good their dental hygiene is?
Yeah, great question. So I always talk to parents about 5 things that contribute to decay because it's multi-factorial. One is genetics. Some people's saliva just doesn't combat the acids we consume as well as others. For example, I eat a strawberry, my mouth is going to be acidic on average, let's say for 30 or 45 minutes. You might have some people's genetics that can buffer those acids out in 10 minutes, and their teeth are going to be a lot healthier over a lifetime. If you can buffer out the acids because it's the acidic environment is where bacteria that causes decay grows. So the more frequent your mouth is acidic, the more frequent your teeth are going to get broken down. But yeah, so genetics plays a big role. And you can't change that. You can just be aware of, yeah, our family tends to get cavities easier. Because I've seen fraternal twins that same household, I see plenty of siblings, same household, same diet, same hygiene habits for the most part. They're young kids, but one can end up with crazy amounts of, cavities and the other one spot free. Or I think yesterday, even I had a kiddo that mom's like, this kid just doesn't take care of his teeth and he never gets cavities. And then they have a sibling, a sister that she's fantastic, flosses, brushes, and gets cavities. Genetics plays a role. How well we brush, how well we floss obviously play a role. What we eat and drink, I think, plays a huge role. But the kicker is kind of what I was getting into is how frequent is the mouth acidic, and carbs and sugars is what our mouth turns into acid. And so if we're snacking on, fruit, chips, cookies, candies, breads, crackers seem really innocent, or milk, juice, those things like that.
One question that I'm so curious about, braces. So can a pediatric dentist or a dentist that's like taking x-rays, looking in a child's mouth, can you kind of assess whether or not they would require braces later on?
For sure. Yeah. Yeah.
Oh.
For sure. Yeah. So, I mean, an orthodontist is a dentist, you know, to start with. They go to the same dental school. We go to, 4 years of dental school together, and there's a lot of general dentists that are doing orthodontics, that just graduate from our 4 year dental, school and go out and do very basic orthodontic cases. An orthodontist that's only doing braces all day is a specialist. They're getting the cases. I mean, they're getting as many cases as they can, the simple ones, but they're also getting the really, really complex ones. So, long answer to yes, I can look at teeth at the age of 3 and know whether this kid is going to for sure need braces or very likely need braces, or what, they got great space, and they're on a great path to probably not needing braces. We look at teeth at the age of 3, and also um, can predict, or even I can look at teeth and guess that this kiddo might have even airway issues, nasal airway
Mm.
issues. The more kind of compact and crowded those teeth are, the higher the palate, the smaller their little nasal airway. And I can look at a kid's teeth and be like, Mom, is your kiddo snoring or mouth breathing? And kind of predict not just will they need braces, but also how many airway issues, how many issues are they going to have from this, this really crowded tiny little mouth?
I feel like the airway thing, our last dentist was really into that stuff. And
Yeah.
I remember bringing Milo in and they were asking me all these questions. And I was like, Jesus Christ, like, I don't know.
I
Like,
don't
does he
know.
grind his teeth? Like, does
Yeah.
he
Yeah. Yeah.
snore? And
Yeah.
it's so important. And I feel like
Yes.
when we were growing up, that wasn't even a thing.
100%. Honestly, like through that's the funny thing is throughout training, it's airway. A dentist should be able to um, identify potential airway issues, but we never learned how to treat it. So a lot of dentists end up not really screening for it,
Right.
and or saying, it's something we'll outgrow. So when I was a kid, and honestly, even as a provider early on, it was like, okay, I'm seeing severe grinding. This kid is grinding halfway through his teeth. Mom's saying they wake up at night a lot. Um, they just can't get him to stay asleep. We're snoring or we're mouth breathing. I get a kid in my chair that's only mouth breathing. They're not congested, but they're just blowing air right into my face. It's awesome. Uh, Early on in my career is like, well, hopefully we outgrow this, and we turn into adults that haven't outgrown it. So I actually hired an airway dentist. She's on our team full time now to get kids as young as 3 into airway treatment to try to bring that palate bone back down and grow that maxilla the right way so that you're breathing right at a young age. Because mouth breathing or getting poor air at night is terrible for your health, and especially long term. So yeah, she's doing
And
that, and it's awesome. The cool thing about airway dentistry is it can feed right into orthodontics. If you grow the maxilla the right way, oftentimes the adult teeth come in the way they're supposed to, and
mhm.
you don't need braces.
And the treatment for that is usually like a retainer thing, right? That they wear at night.
Yeah, so I got 3 of my sons in these little mouth guards that they just wear to sleep with, and it's designed to keep the tongue off of the palate and the cheeks off of the teeth to allow them the arch to grow the right way. Sometimes we have these overcompensating muscles that are taking our dental arch from really, this nice wide U shape to this like V shape. It's condensing and collapsing everything. The only way, the only space the palate can go is up into the nose. And so, yeah, my kids, and, airway treatment, just sleeping with this mouth guard for a few years, you're learning these different muscle exercises, myofunctional therapy to kind of correct those imbalances that are creating this really, collapsed and condensed
And is
maxilla.
it super important to address it at a young age because that's when they're growing?
1000%.
Like, are
Really, really,
adults screwed?
not all the way, but it's just
Oh,
a lot. It's
a
a
little bit?
lot. Basically, no. It's just a lot. Well, one, it's a lot more expensive
Yeah.
to treat an adult this way to kind of grow things apart. And it's not just expansion like orthodontics does. It's actually trying to grow that full maxilla to where it needs to be. And so, yeah, there is treatment for adults. There's airway dentists treating only adults. It's just a lot more extensive and a lot more difficult to grow that maxilla and to correct those muscle habits at the age of 45 when you've ground through all your dental work, versus the age of 3 or 4. It's you sleep with a mouth guard for a little bit, and kids are used to sleeping with binkies or thumbs or bottles. But yeah, much easier to correct and to kind of guide the growth the right way at 3 or 4 or 5, up to even the age of 12. Is
Yeah.
the time to do it. The sooner you get in, the better.
Yeah, I should be doing jaw stuff, but I'm just like, "Oh my god, I can't even, like, imagine adding that to my life," you know?
Same,
But
same.
when I was growing up, it wasn't, like, a thing. I got braces only on my top teeth, and so they were like, you could either A, break your jaw and, like, bring it forward, and I was like, "Well, I'm playing volleyball, so no." Um, so instead, they took 2 teeth out on top and then just pushed my front teeth
Everything back.
back. But
Yep.
now my jaw is so messed up because it's, like, back, but it should be out here, and my new dentist now, she's, like, telling me all these different options, and I'm like, "Oh my god." Like, I wish I would've just broke my jaw when I was 19 and not played volleyball that year, but here we are.
But you're
So
19. You're like, that's volleyball is life at that age, right? You
Volleyball is
know?
life. Yeah.
And but that's the issue. Not that volleyball's life, that's a great thing, but is that we're like, we'll outgrow it, or it won't be that big of a deal. And you're 38,
Yeah.
I'm 34, dealing with these things for how many more years? Like 60 more years? We're just gonna live the rest of our life with, we
Yeah.
got nice straight teeth. The orthodontist did their job, but it's kind of like dentists that are just looking at the tooth to fix
Yeah.
and not zooming out and looking at the human connected to those teeth, and the
Yeah.
family connected to that human, and the community connected to those families. So yeah, the sooner we can get in, it's a very simple thing to address.
And it is wild because like my jaw sitting where it shouldn't be is connected. Like I get pain, like temporal pain. I'm
Yep.
constantly clenching my teeth. I have sore neck all the time. Like the fact that everything is connected and you start to realize like, oh my God, like, okay, my
Yes.
jaw isn't sitting in the proper place, but that leads to a million other issues. So yeah.
100%. Like I say that a lot to parents every day is for some reason dentistry and medicine are separate,
Hmm.
and not just our schools and our training, but in almost everything that we do, and how we practice, and how we're treated, with insurance companies or whatever it may be. And I don't get it. Like the mouth is part of the body, but we're often treated like, no, it's not. It's not connected. But everything you just said is exactly that. 95% of systemic disease manifests in the mouth in some way or the other. The mouth is the gateway. It's how we get all of our nutrition to fuel the rest of the body. So, um, but it's very easy for people to understand that, if they have a bad ankle or a bad knee, over time they're going to develop an imbalance, and their hips going to hurt, or their lower back. Same thing, with your jaw. Same thing with your teeth. And
Hmm.
so, surprisingly, yeah, the mouth is connected to the body, even though sometimes in medicine it's very separate. Um,
Yeah.
yeah.
I know. Like I dream of a world where like your health, it's just like a health center and everything is there. Like naturopaths, like Western medicine doctors, dentists, like just all the things in one place and that they communicate with one another,
Yes.
Like, yeah.
Yes.
Cause like you were saying, like medicine and dentistry is separate. And it's like there's no communication
There's none.
yeah, like it's nuts.
Like 100%. Even, I mean, not just provider to provider, but like the research, the academies, these big large corporations that are doing a lot of our, guiding us in how we should practice, they're not connected. They don't
Hmm.
communicate. So how are we, from on a provider to provider level, going to correct that? And that's actually one of the dreams I had early on in dental school. Is like, I want to create a spot that at the very least is me and a pediatrician. Um,
Mm.
and so, kids are coming in for their wellness checkups, and we look at the teeth, and then vice versa. Um, you come in for a cleaning twice a year, and you get your pediatrician in there just to, check on you, and you're building trust that way. It's a lot tougher to to fulfill that dream than I ever imagined.
Like
With
logistically.
logistically, billing, insurance. I mean,
Yeah.
you basically have to have two, fully functional teams, uh, that are experts in two entirely different fields. It feels like, even though we're talking about the same kid, we're just talking about their mouth and everything else. And even just adding an airway dentist, I feel like was awesome for my practice. I can't imagine how cool it would be for a parent to have everything you're saying. And I do think that is attainable. I think technology needs to catch up, in how we, like, our patient management systems, our softwares, to be able to transfer information. It's tough, like provider to provider across, you know organizations,
Hmm.
but they do it really well in hospitals. I worked in a children's hospital for 2 years, and they do transfer information really well. So the techs there, we're starting to get there, but it would be really, really cool to have. And I think there are some community health centers that do have like a dentist on staff and physicians, but it's not the norm. And
Yeah.
I think we could do it better and more often.
One day. I wanted to bring up
Just
one
like your jaw.
yeah, stupid jaw.
One day.
One day. Um, one quote that I got from your TikTok that I loved was treatment without trust leads to trauma. Like
Yeah.
that was so good. Can you explain what you mean by that just a little bit?
I mean, man, that like those words, that phrase, I didn't know when I sat down to film that's what would come out, but like I feel like that is one of my missions on this planet is to prevent that or to really preach that truth that um yeah, treatment without trust is trauma that oftentimes, at least growing up, going to the doctors or going to the dentist, I still to this day, I have no idea what's happening, like what's next, what they're talking about. And so it feels like I don't trust anything that's going on. I'm on high alert. And so it might be something really basic like um, just anything that happens in a hospital or urgent care or physician or dental setting that just feels I don't know what's happening. I don't know why I'm in this room half naked. I don't know what I'm wearing. I don't know why I'm laying down. I don't know what they're doing. There's been no explanation. I don't know how long I'm waiting um, or what they're looking at. And so something that could be really basic could be this thing that I carry for me or this trauma. When, in my practice, and we're not perfect, every kid is different, every parent is different, but we try to really, really set the stage for what the entire visit's going to look like from the second you walk in. And then we give you reminders throughout of, hey, this is what's next. This is what we're doing. And I show kids every time we do something, I show them on their finger and say, this is what we're looking at. This is what it's going to feel like. And we're kind of trying to talk them through um, that communication is going to build trust, showing them, telling them where they're at in their experience. You're halfway there. This is what follows. This is what we're waiting for. Builds the sense of like trust and like, okay, I know what's happening. I know what they're talking about. I know what's going on. And you'd be amazed at like the 2, 3, 4, 5 year olds that come in terrified. We talk them through things. We meet them where they're at, and we're able to do anything. We're able to take teeth out without a kid knowing or caring, because they're just like, yeah, I know what's happening. I know I'm safe. And it can't be something that's just like, hey, you're safe. Listen to me. Trust me. Shut up. Open your mouth. That's not how. But that's how we grew up doing it, right? So,
Uh-huh.
um, yeah, I think, and I don't think that truth is really like singular to just healthcare. I think that's I really think that's the foundation of what happens with even childhood trauma is
Mhm.
treating a child in a certain way without trust or without repair is going to lead to trauma and or even with our partners or whatever it may be. So yeah, I really try to resonate and permeate that through how I treat kiddos and parents.
I think anytime you go into a medical provider's office, there's a power imbalance, even for adults. It's like, oh, I'm the patient, like I'm getting help from this person. Uh, like I have to listen and you know what I mean? And I think
Hmm.
you not being in scrubs and just being in regular clothes that they would see their parents in, like it almost eliminates and like explaining everything to them and showing them the tools on their hands before you do anything and taking that little bit of extra time and those little changes eliminates some of that power imbalance and gives them power and makes them feel like, oh, I'm a part of this. Like I'm not coming here to have something done to me. I'm a part of this. Yeah.
1,000%. And I think exploring that like at least in my case with it's provider, parent, and child, exploring that triangle of I'm just one piece of your care. You like parent is another piece and child is another piece, and all three of us have to understand what's happening. We have to understand the importance. But often when it's I'm the doctor, I got my I went to the school, all the schooling, I know better than you. It's yeah, it's not a triangle. It's I'm better than you. I know more than you. Listen to what I say. And like, how much change are you going to affect seeing someone for 4 minutes, just telling them everything they've done wrong and then walk out of the room?
Mhm.
Right. So yeah, I think to really have people that are insured or not insured, that, those 50% of people that didn't see the dentist last year, to get them coming to, coming to you regularly and taking care of their health, it's involving them in their health, like giving them ownership of their health, because it is their health. I
Mhm.
can't care more about your teeth or your health than you do. And when I come in and act like I know everything that you don't, and you have to listen to what I say, and you've been a bad kid, you've been a bad parent, like, no, it's your health. I can give you, the updated research on a certain topic or a certain, treatment choice, but really it's up to you. And so that's when I'm talking about treatment, I always give that as a first option to parents. Like, I mean, here's your options. One, you can do nothing. This is your kid. This is your mouth. You can always do nothing, and this is probably what'll happen. Or we can go this route or this route. This is maybe why I'd go this route. Let's talk about it. Where does that land with you?
Mhm.
Um, and yeah, I've seen a lot of success with that.
My question every time there's like a dental thing or a medical thing, I'm like, if you were me, what would you do? Because that's usually a good indicator, right? Like, so if
Yeah,
knowing everything that you know,
yeah,
and
yeah,
this
yeah.
is your child in this situation, what would you do? And then I'm like,
Yep.
okay, let's do that. Okay, but before I ask you about your toothpaste, which I don't think is available in Canada, which like that's
Come
sad.
on.
Is it?
Yeah. So I gotta ask, because I think I think we weren't for a minute, and we may be. I know we're available on Amazon now.
I checked Canadian Amazon and it didn't come up.
Yeah. Let's make that right. If we're not in Canada right now, then let's make it happen.
Okay,
We
I'm
love
excited.
Canada, by the way. I'm
Oh
like,
my
I want to be
god.
Canadian.
You
We
do?
went to Banff this last summer. We're going to Banff again this summer. Like, my dad grew up in
Nice.
Calgary. I want to be Canadian.
Oh my
When I was there, I'm like, I'm
god.
Canadian now. I love it. Yeah,
Oh,
like
that's so
super
nice to
clean.
hear.
People were so nice to us. Like, love
Do
it.
you live
Yeah,
near the what's the little like famous part where they have like the film festival in Salt Lake?
yeah. Sundance Film Festival. Yeah, yeah.
What's that area called? The
So there, I mean, there's Park City, which is
Park
like
City,
where,
that's what I'm
yeah,
thinking of. I always want to
yeah,
go there.
yeah. So Happy Tooth is like 20 minutes from Park City.
Oh, cool,
Yeah,
cool, cool.
everything's close here. Yeah,
Yeah, I love that.
come visit.
Okay,
Salt Lake's the best.
oh my God. I really, really do. I want to go to that Park City place and do like a winter kind of vacation when it's
Love it.
wintry. Yeah.
So Banff felt a lot like Park City should.
Yeah. Yeah.
Like Park City's, I think, a little bit bigger now, and it is what it is. But like, I felt at home in Banff because yeah, it's a lot like Park City. So
I love
there
that.
you
I'm
go.
Canadian and I've never been to Banff, but I've been like Vancouver, Victoria. I'm in
Cool,
Toronto area.
cool. Yeah.
Um, but anyways, this is my important question for you that
Okay.
I talk about on Instagram all the time. How do you feel about tongue scrapers?
Tongue scrapers. I'm for it.
Oh my God, they're
Yeah.
the best.
Yeah. Yeah. I think if you're not using one, go
You're
look at your
gross.
tongue. Yeah, go
Yeah.
like lick your skin and smell it. Tell me how your tongue's doing.
Okay, but like why and I ask every dentist this, like why is it not more common that people are using tongue scrapers? Like it should be like a toothbrush. Like when I go to the dentist, they should be like, "Oh, and here's your complimentary little tongue scraper."
Yeah, great question. I think that's a market that should be disrupted. Like,
Okay, happy
I need to
tooth
create Happy Tooth
tongue
tongue
scraper.
scrapers. Yeah, I mean, we got. Let me just show you here. We got toothpaste like crazy. We got toothbrushes. We
I love
got
it.
whitening strips. We're waiting on. We got floss coming out and mouth rinse, but
Oh, I
tongue
love
scrapers needs
it.
to be on our docket. That needs to be
100%.
something that happens. In that regard, though, like, there's a lot of just. I don't think dentists do an awesome job at explaining anything, especially dental companies and like toothpaste companies. Um, Toothpaste should be looked at way more as a supplement than this thing that's actually cleaning your teeth.
Mhm.
Because we'll brush with toothpaste and then we'll go drink water. No, that rinses the toothpaste right off. And that's not common knowledge. The toothbrush is going to clean your teeth. The toothpaste needs to sit on your teeth for 2 or 3 hours to act as a supplement you need it to. And so that should be common knowledge, just like the tongue scraper. Like, we should let toothpaste sit on our teeth. We shouldn't sit and rinse or go drink water after. Let the toothpaste be, spit it out, let it
What?
just sit on your teeth. Right? That is
You
to
just
me
blew
just
my
as
mind.
important as tongue scraping. Like, toothpaste itself, if you rinse it off, sure, I mean, you're going to get a little bit of absorption into the teeth, even, just by brushing, but you're going to get significantly more. You're going to get what you're using toothpaste for, that enamel, rebuild, if you're letting it sit on the teeth.
This is nuts. Because every time Milo brushes his teeth, I'm like, hey, rinse your mouth, rinse your mouth. And if he doesn't, I'm like, oh, like kids.
100%. Well, and that's kind of the crazy thing too about toothpaste. I don't want to go too far down this rabbit hole, but because I am a toothpaste nerd, but actually, I'm really not. I'm just teeth. But um, most grocery store toothpaste has a poison control warning on it. So to me, it like that alone is like, yes, rinse that off your teeth. But first, why do we have poison control warning on our toothpaste? Why do we have chemicals that we're so worried about kids swallowing or adults swallowing that we would have to call poison control? Like, we've gotten away from a lot of those things in our day-to-day deodorant, shampoo, household cleaning supplies, but we're still fine putting it in our mouth, which is kind of spooky. Um, but yeah, two, like, why do we have something that we have that is shouting at us to rinse off? Let it sit. Let that toothpaste sit.
So is the Happy Tooth toothpaste like natural? Because right now Milo is still using the toothpaste that they don't have to spit out into the sink. And he tried using like a quote unquote big boy
Yeah.
toothpaste where you spit it out, but he doesn't like it. He doesn't want to do that. So we're still just using the one that he can swallow and
Yeah.
let it sit in his mouth. So should adults like, because one of my questions was, when do they have to switch to the kind of toothpaste that has whatever it is in it where you have to spit it out in
Yeah.
the sink?
Yeah. Great question. So, um, really, the point of toothpaste is to remineralize your enamel, to strengthen, like, as a nice little supplement for your enamel. So, we found two things on this planet that do that help strengthen and rebuild your enamel. First is our saliva. Our saliva does it through a mineral called hydroxyapatite on its own. That's happening all day. We consume carbs and sugars, we break it down into acids, that breaks our teeth down, and our saliva uses hydroxyapatite to rebuild our teeth. Happening all day, no matter what we're doing. Um, Toothpaste either needs to have fluoride or hydroxyapatite. Those are the two minerals we found on this planet that are going to rebuild our teeth. Fluoride became the easiest thing for a long time to put into toothpaste, to put into water supply. And the research is there. It does help rebuild our teeth. And so that's the thing you're talking about. At what age do we start doing toothpaste that has fluoride in it? That's kind of the mainstream and what we've been doing for years. The scare there is, what is fluoride doing to the rest of our body over a long period of time? And there's some kind of spooky new evidence that fluoride might not be the best thing for us long term. It's not natural to our body,
Mm,
but it does. It does. There's clear evidence that it does rebuild your teeth, right? So toothpaste either needs to have fluoride to rebuild your teeth, or hydroxyapatite, which is what our body already has. And that's what Happy Tooth toothpaste has. That's what a lot of natural toothpaste brands have, is hydroxyapatite, and that is less mainstream, less commonly used. I think the dental community at large isn't quite there with it, even though the research is. It's just as effective, go figure, as fluoride, because it's what our body's already using to
yeah.
rebuild your teeth. We're just supplementing. We're putting enough into toothpaste to now supplement and kind of give you an extra boost. So here's the problem with training toothpaste, or toothpaste you can swallow, is it doesn't have typically either of those things. It doesn't have fluoride because we're scared of kids swallowing at a young age. We should be scared of adults swallowing it and lifetime use of it, at least, in toothpaste quantities. It doesn't have hydroxyapatite for the most part. Most training toothpaste don't. So really, you might as well just brush with water. Not the end of the world. You're still going to clean the teeth. but you're not going to rebuild them. And so, yeah, Happy Tooth toothpaste. I wanted to create a toothpaste that's not like every grocery store toothpaste. It's all natural ingredients, and it has that other mineral, hydroxyapatite, that helps strengthen the teeth. So yeah, I'd get your kiddo some hydroxyapatite toothpaste, some Happy Tooth. Hey,
Crazy.
we're gonna send you guys some. I don't
Oh my
care
God.
if we're shipping to
Thank
Canada or not.
you.
We're gonna figure it out. We'll send you. We got. I gotta show you these because I'm so proud of these. My
Like, it's
kids are
the
the same.
coolest.
They hate like the mint, like that foaming, burning, tingly like feeling.
The spicy.
The spicy, exactly. So the funny thing is grocery store toothpaste, those things are marketing ploys. Those are from chemicals that are just meant to make you feel like your mouth is clean, but they're not
Yeah.
doing anything. They're not rebuilding
Yeah.
teeth. So we created like a really soft mint. It's called fresh mint. My kids love it. It's not
So do you
spicy.
use that as an adult?
I 100%,
Oh my God, I'm
100%.
so excited. Yeah.
Yes. And then my kids love this one. It's vanilla frosting.
Oh my
It like
God.
tastes like they're like some of our reviews are like, I have to hide this from my kid.
Yeah.
And we just came out with this one. This one's really fun. It's like a sweet orange,
That
which
is
seems
so cool.
different, but yeah, they're great for kids, adults, and we're off to the races with creating. I mean, essentially, I got a lot more traction in my little small corner of the world with this practice than I ever thought that I would, by being on social media and treating the dental visit as this happy, silly, fun spot. I got a big wall that says "Bite Me" on it. I got tattoos. I got all these things, and I dress a funky way, um, normal, not in a white coat. But that, like, there's something to this that we have going on in this small corner of the world, and so. Uh, Ultimately, my mission is to change the perception of dentistry, to let dentistry be this way, to not be so
Mm-hmm.
sterile or
Yeah.
boring. And now we're doing it in the product field because I can't be in 1,000 different practices around the world. But let's
Yeah.
make products that are silly and fun and loud and clean and safe. So yeah, we got like 5 more products we're launching over the next little bit. But
Okay, well, I'm gonna wait for your tongue scraper.
yes,
Happy tongue.
yes, happy tongue. Get the happy tongue. Yes, I'm
I love it.
done.
Okay, so if we go on our winter vacation to Salt Lake City, then I'm gonna bring Milo by the office. How
Do
about
it.
that?
100%.
Okay, I'm
Yeah,
so
we'll take care of
excited.
him for free.
Oh,
Like on
I
the
love
house.
it.
Easy, easy. Yeah.
Oh, I love it so much. So, what are your plans for the future before I let you go? Like I was thinking like you should have a YouTube channel.
Great question. Yes, I should. Should. Um, I mean, I've been at my practice for just 3 years, and it's been, from the ground up. And I thought I would, initially I did start like a little YouTube channel. We were doing, a podcast type thing. We were everywhere all at once, and I had time for it. And now that I'm seeing as many kids as like as humanly possible, and my kids are getting older, I feel like I'm taking on less and less in my life and just doing what I'm really good at. But that being said, like there's a need for it. There's a need for this new kind of fresh take on dentistry. So I gotta find the time. I gotta find the time to be on YouTube. I gotta find the time to be more active. Pushing this mission. But I think like overall, what does the future look like? I'm going to continue to do dentistry differently, whether it's in my practice or with my product company. We started a foundation that's doing dental charity different, and that's it. I really want that 50% of people that didn't see a dentist last year, probably because of fears or misunderstandings or whatever it may be. I want those people to come back. I want the younger generation of dentists. I want the kids to be like, yeah, that guy looks different and he's a dentist. I want to look like that. And we get that. And so, not that I look cool or any type of way, but I'm just me. And I want people to be just them when they go out and be healthcare providers. And I think we'll have a lot better, like, health outcome,
Mhm.
in large. And so that's where I'm at the next little bit. But yes, I mean, we have a small little YouTube channel from our TikToks and Instagrams we post, but I just haven't dedicated enough time to it.
Do you know Miss Rachel?
No,
on YouTube. She's like a
no.
YouTube for kids. Like I picture you
Okay.
doing that in your office, like teaching kids about going to the dentist.
Need to do it. I need to do it.
Okay. I
Let's
feel
do
like
it.
everyone that comes on my podcast, I'm like, listen, I got an
I
idea
got
for you.
like like that's the thing. I need to dedicate the time.
It's tough.
It's just tough. Like when
Uh-huh.
I'm at work, I want to be fixing teeth, you know. Like trying to even get this hour together is
Mm-hmm.
I think it's taken us like a month or two.
Thank
I'm
you.
sorry about that. Yeah, no, I'm
No
sorry,
problem.
but we're at it. We're doing our best day by
Awesome.
day.
Well, thank you so much for this conversation. It was lovely to have you on. I discovered you on TikTok. So, yeah,
Thank you.
I'm excited that you came on and we will
You
share all
bet.
this information with my listeners.
Okay. Thanks for having me. Come pull up to Park City.
Of
Bring the
course,
kiddo
we
in.
are.
Let's ski and get some teeth cleaned.